just say no. Kids are too smart for that. They want science behind that, why they shouldn't be doing it. These kids could get a hold of this and that it was such high potency. Talk to your kid. Don't sit down at the dining room table and say, now we're going to have a talk. For a safe, healthy, and drug-free community. Watch
Step Up to Save Our Children today.
Hello, and welcome back to Step Up to Save Our Children. I'm so glad you're here with us today. My name is Denise Mayer, and the topic that we're going to discuss today is supporting the silent struggle of teen mental health with 1 in 5. This podcast is attempting to meet parents and caregivers where you are. It is your opportunity to get valuable information to educate yourselves so that you're prepared to talk to your own children with honesty, truth, and I think most importantly, authenticity. Today, we're diving into a topic that sits at the heart of every family, every school, and every community, the mental health of our teens. We know the pressures on young people are continually rising. Social media, academic stress, constant comparison, and a world that never seems to slow down. But what's really happening behind the numbers, and what can we do to support the teens in our lives? To help us understand the full picture, we're joined today by Tricia Buchert, the Chief Program Officer at 1 in 5. 1 in 5 is an organization leading the way in youth mental health education, awareness, and prevention. They work directly with students, schools, and families, and they bring both data and lived experience to this conversation. In today's episode, we will explore the state of teen mental health in 2025, soon to be 2026, the warning signs that parents often miss, and the practical steps that we can take to create environments where kids feel supported, connected, and seen. This is an honest, hopeful, and deeply important conversation, and I'm so grateful that you're listening. So let's get started. So my guest today is Tricia Buchert, the Chief Program Officer at 1 in 5, an organization dedicated to stopping the stigma and starting the conversation around mental health. With a mission rooted in suicide prevention, 1 in 5 provides education, training, and awareness on mental health literacy. The signs and the symptoms of suicide and the protective factors that help individuals thrive across schools, community spaces, and workplaces. Before joining 1 in 5, Tricia spent 32 years in public education with the Marymount City School District, serving as a special education teacher, school counselor, and finally in administration as the Director of Student Services. Her career has been devoted to supporting young people, empowering the adults who guide them, and building systems where mental wellness is prioritized. So please welcome to the podcast, Tricia Buchert, a leader in prevention and a lifelong advocate for creating communities where every person feels seen, supported, and valued. Welcome, Tricia. How are you?
Wonderful. Thanks, Denise, for having me. I'm excited to have this conversation.
I'm so excited to have you. 1 in 5, I feel like, is one of the few organizations that really gets it, gets the kids, gets the things that they're going through, understands, and is continually supporting the community and trying to help. So welcome today.
Appreciate that. Yeah.
Thank you. Well, I guess to get started, let's just talk for a minute about what the term mental health really means, because I think a lot of people really don't understand that, particularly where it relates to teens.
Yeah. I think that's a great place to start. So when we talk about mental health, we're talking about your ability to manage stress in your life. So that's just how are you able to manage stress in your life? That's a simplistic definition. And if you have good mental health, you're able to do that in a healthy way. It's not that when we say you have good mental health, that doesn't mean you don't experience sadness or anger or feelings of depression or anxiety or anything. It's just how are you, if you have good mental health, you're able to handle the stresses that come into your life better. And so there's lots of ways, and we know there's lots of research, so much more research on the brain and body and how we can do those things so that we can have good mental health. So when we're talking about that, that's what we're really talking about. Mental illness would be a different way, a different discussion when you've had a diagnosed mental health condition, a medical condition. So mental health is just your ability to kind of manage stress. And when we look at kind of the statistics, 40% of teens are experiencing persistent feelings of sadness and or hopelessness. 1 in 4 adults will experience a mental illness, 1 in 3, if we're talking about ages 18 to 24. And as someone who's worked in the schools for a long time, those stats feel real. I think often when I've done any kind of education with parents, they're always kind of surprised and like, well, not here, or that's not us. It really is. Like you
Mhm.
talk to any educator, it has really changed, and mental health or kids that are having issues with their mental health, it expresses itself in different behaviors,
Mhm.
all kinds of different behaviors. And so when you talk to educators now, it really has changed, and they've had to um, kind of almost up their game in terms of how they can handle different behaviors in the classroom. So I think everyone's feeling that. Parents are feeling that. You're hard pressed not to know someone who's dealing with mental health in their family. I just think it's something that is universal, and we all understand is a bigger issue now.
Well, and I think, like you said, everybody goes through this. It's just that, our teenagers, brains aren't fully developed. They
Mhm.
don't have all the coping skills that hopefully parents have, evolved with over the years. And it makes it so difficult. So, but you've spent 3 decades working with
Mhm.
youth. I mean, you just need a medal right off there. That's right. I mean, it's unbelievable. But how have you seen this conversation, like you're talking about, around mental health evolve in the schools just in the last, probably since social media has probably been one of the biggest stressors, I would guess, that is new, like compared to the generation before?
Yeah, I started in the early 90s. We weren't really talking about mental health. We weren't using those kinds of terminology. That was reserved for more significant mental illnesses, bipolar, schizophrenia, things like that. It was kind of thought of or discussed in that way. And just mild depression or anxiety, that wasn't really, people weren't sharing that openly, kind of like you had to deal with it on your own. And then I would say I was a school counselor at a junior high from 2000 to 2010. And I would say around 2005 is where I saw things starting to shift, where there was some more self-harm.
Mhm.
Things started ticking up even before social media. It was changing prior to that too, because I think it's not all social media. We know there's, sleep, nutrition, environmental factors, certainly parenting styles. There's all kinds of different things that affect, a student's mental health. So, but that's kind of when I saw that we started talking about it in a little bit different way. And then certainly technology changed the game a lot. And so then in 2010 or so, that's when schools started adding mental health partners. So now in the Cincinnati area, at least, most school districts have a mental health partner, meaning where kids can get therapy right there in school through a organization that is kind of has an office within the school building, which was very, very much needed.
Mhm.
And parents were very open to that. And just over the years, I think more parents are more open to that conversation. So even when we were doing that in our district, it was, do you think people will use it? Will they feel comfortable? Will there be a stigma with it? And we did not have that issue. So that was about 2012. And then it's just, gotten better and people are way more comfortable now. That's the kind of the positive part of social media, right? It's stopping the stigma. Um, by getting the word out that it's okay to talk about all of this. So there's parts of social media that have been positive and helping to reduce the stigma for sure.
Yeah. And the stigma is such an important aspect for the parents as well. And I always say, if the parents could just get together and, be honest with each other about some of these things, it would be so helpful to them and to the teens. But when you were saying that just being able to talk about these things, I'm thinking about even when my kids were like in school, back in the 80s and 90s, I guess, if somebody said that their child, was depressed or what, I mean, you'd be like, oh my gosh, it's just unfortunate that that's the way it was, but you're right. That's a positive that now parents are embracing that and wanting to
Mhm.
know what's going on with their children.
Yeah,
Yeah.
and I think the youth don't have a problem talking about it. They feel very comfortable talking about it. It's really for the adults to get more on board with that and feel comfortable. And there's definite education and ways you can do that for sure.
Right. Well, don't you think, I'm just saying this because I think it, but parents sometimes, they feel like they're being judged and,
Mhm.
like, well, whatever, I don't want to talk about it because they'll think I'm a bad parent or, whatever. And really that's the saddest thing because we know there's no perfect parents, and there's no, I mean, obviously there are some, addictive factors and things that can play roles in all of
Mhm.
this. Not really talking about that right now, but just the things that parents don't recognize with the kids, I think, is why this is so important for a professional to say, hey, maybe if you did it this way or talk this way, you'd get
Yeah.
further or whatever. So,
Yeah.
yeah, so talk a little bit about the prevention end of it versus like, now we've got a huge problem.
Mhm.
Uh, let's talk
Yeah.
about that for a little bit.
Yeah, so 1 in 5, we do that prevention work, and even in a school, schools are set up where they do, we call that tier 1, kind of things for everybody, just kind of universal kinds of things that you do, and then when we talk about interventions, there's different levels of those, and 1 in 5 does not do intervention work. So prevention is, that education, becoming self-aware, just understanding signs and symptoms, warning signs, how to talk to kids, just educating people. So it's very upstream. We're educating youth and adults on protective factors. How can you prevent,
Okay.
and have good mental health? Prevent issues and have good mental health. So there's very specific evidence-based things that we follow that can make a big difference, and we see that happening. I have seen that as an educator, as an administrator, bringing in those programs to our district, and we saw rates of anxiety and depression, go down as we did a better job of educating students.
Mhm. So when you did mention protective factors, so, the average teenager, um, needs obviously those protective factors so that these things that they're feeling don't escalate the stress. So why don't we talk about those a little bit? I'm not sure how much, the audience knows about the protective factors.
Yeah, we do a lot of education in this space at 1 in 5. And I think as a listener, if you're just, think about the people, places, activities, things that give you strength, that bring you joy, lift you up, or make you feel connected. Those are kind of your protective factors. And these are going to seem obvious, but this is some of our stuff comes from a program called the Sources of Strength. It's
Mhm.
a great organization. It's a peer-led where students are, we go into schools and we teach the adults and we teach the students about their sources of strength, these protective factors. And then what the kids do is they come up with ways to teach their classmates. So they have peer leaders and then they teach their classmates and they run things called campaigns where they're teaching each other about, hey, you should have these in your life. So I'm going to go through kind of
Yeah.
what those are, and then I'll highlight a couple of them for this conversation for parents.
Okay, great.
So we talk about mental health, therapy and getting access to mental health supports. Family support is a protective factor. Positive friends, mentors, trusted adults in your life, healthy activities. Um, generosity, kind of service, acts of kindness, that can makes you feel good when you give to others. We talk about spirituality, and this is not, it can be religion. It doesn't have to be. A big part of spirituality would be a gratitude practice, being in nature. Prayer can be that, or specific religious practice, but just a spirituality practice in your life, and physical health. So those are the protective factors, and there's lots of education that goes into, teaching the kids about those or teaching adults about those. But I think too that would be good for this conversation would be just talking about family support and mentors. So family support which I think when you listen to those, you're probably like, well, those are obvious. If you have positive friends, that helps you get through stressful times, that helps your mental health. And family support is a big one. And so one of the things that I think in the age of technology that's changed is just think of having a meal together without phones at the table, and having conversation. It could be, we talk to kids about, you could, cook a meal with your family. You could take your sibling to do something, call your grandparents and check in on them, have a game night, just doing things as a family unit. And I think, families are more, kids have a lot of different activities. I would say more so than used to be. Things are very scheduled out, and maybe that loss of family time is one of the consequences of that. And certainly, I know everybody talks about if you go to a restaurant, seeing families on their, people on their phones, and but I know a lot of youth who are, doing things so that they put their phones. They have rules around that when they're out to dinner together and things like that, just so you're having more conversation, and really, utilizing that family support. Your kids need that. Obviously, everybody knows that, but that is something just to be said, is like working on how you strengthen that family and that foundation for youth. That's very, very important. And I want to say not everybody has, you can have a chosen family too, right? So it may be that you're in foster care, you have a difficult family situation. There are chosen family that you can have that can be very supportive as well. For
And
sure.
that's where, like, the mentors could come in at that point,
Yep.
that and be like a part of that. I know that, there, as I always say, all families aren't created equal, all parents aren't created equal. And, so there's a lot of things that teens are dealing with that you might not even know. So with these protective factors, and I always say one of them, you said physical health and just getting outside and being
Mhm.
grounded, with what's going on in the neighborhood or wherever you live and just being out in nature, I think sometimes can be really important too. But I know the family thing is, we have an extended family that live all around me here, and it is such a blessing that we
Mhm.
know what's going on with each of the grandkids and, what all the things that are going on. And I just feel so blessed, and I just wish everybody could have that because you know, who knows how everybody's going to turn out. It's a little early, but you want that for yourself, but you also want that for the kids to be able to reach out. And I feel so bad. And you must have seen a lot of this with kids that needed that one person in their life and they really struggled to find them.
Mhm. Yeah, absolutely. And that's why mentors is on there. So, we talk a lot about being a trusted adult. And
Hmm.
so, how can you be a trusted adult? And there's I think, very specific ways to do that. Communicating with youth. How do you do that? But yeah, I think somebody that it's not you're not when you're a trusted adult, you're there to listen. You're not there to fix every problem.
Hmm.
Um, I think that can be, kids don't really want that. They want to be able to go to someone who's not going to judge them and they can share some of that information. As a school counselor, I experienced that where kids would come in and just want to talk to me about what was going on.
Hmm.
Counselor's job is not to give advice. It's to reflect back what they're saying so they can hear it and they can figure out what they want to do. And I think that being heard and feeling, counselors are trained in giving empathy statements and providing empathy, and it's just being a really good listener, and summarizing and reflecting back what kids are saying, and that's what a good trusted adult does.
And the
And
key word there is trusted. I just want to
yeah,
say you have to build that trust. You just don't go
yes,
to the neighbor kid and say, "Hey, you can talk to me." This, I mean, that doesn't work like that. Obviously, you have to
no,
build that loyalty, that trust with an adult, or with another teenager or whatever until it doesn't work. And hopefully it does work and that you build on it. Would you say?
absolutely,
Mhm.
and you're being upfront about. Um, you're not sharing all the information that they're telling you with
Mhm.
different people, so you have
Right.
to, be able to keep their confidence.
Mhm.
But you also have to tell them, like, when you do have to tell somebody because they've told you something and you're scared or you feel like they're in danger, right? In some kind of danger. Maybe they're getting into things that you're very concerned about, then what you always want to do is just tell them, like, I'm
Mhm.
gonna have to share this with somebody else because, I don't know how to handle that. I'm concerned for your well-being.
Mhm.
But and my experience with kids over my 32 years is as long as you tell them that up front,
Mhm.
that you do have to share that, you don't do things behind their back, they understand that. Kids understand. And part of why they're telling you sometimes those things is they want help. So they they want you to go get some help if you don't know
Right.
how to do that, right? So
Yes,
I think
exactly.
making sure that you don't try to fix everything. Also, that is you don't have an expertise in, or is above your head, or just feels like, this is really big. I'm not sure. Those are times that, you do want to go get some support from different individuals. And there's lots of people in the school system that you can contact and for resources as a parent, or as a trusted adult for sure. And then obviously lots of community organizations that can help as well.
Well, and really what you're saying to the teen is, I care. I
Hmm.
care about your well-being.
Right.
I care about your health. And so if it's something serious, enough that they're contemplating taking their life, or if they're thinking about, or they're cutting or doing things that are physically harmful, that's a little more obvious. But some of the other stuff, it might not go seen. There was a young man over Thanksgiving, that was a student at Miami of Oxford, and everything was fine. He was smiling all the time, and he took his own life on the night before Thanksgiving.
Mm.
And no one could have ever. They said they just couldn't believe it. There was no signs or whatever. Now there might have been signs that people just don't know about, and we're going to talk
Correct.
about those. Um, it's so unfortunate because if somebody could have stepped in, it might have saved his life. You just
Hmm.
don't know. So you're really saying, I care about you. You're important to me. And so therefore, I'm going to get a little bit up the chain of who can help because
Hmm.
it's kind of out of your.
Yeah. And sometimes just being a trusted adult for a kid, good listener,
Mm,
and you can be kind of a coach. You might ask them some questions. You're not trying to control their life or get them to do certain things, right? You're listening and maybe asking some questions for them to consider, and you are showing up for them. Do what you say you're going to do. So, going to maybe a game that they're in, or a concert, or
mm,
any kind of events that or things that they participate in, or things like that. Like, you show up, you do what you say you're going to do. I can't tell you the number of kids, how important that is for them. I might, as a counselor, might have gone to a basketball game to see a student that had asked me to come, and how surprised and excited
exciting.
they are that you actually came, and then how that changes your relationship, for a long time. I mean, that when you put in that time. So, being a role model, being a mentor for a student is a great protective factor,
Mm,
So if a student doesn't have the kind of family support that they wish they had, finding those trusted adults, those role models that can help them in life is a huge protective factor.
absolutely.
Um, And, kids can find those. I mean, it's very easy, I think, in schools to find educators who will be that person for you. And I think that's important in their school is to have a trusted adult in
Yeah.
that space as well as outside of school. And so kids have choices. They can actively seek that out. And I think we're always trying to make sure that the students know, like, they have options, they're in control, they can build into these protective factors, right? They don't it most of these don't require, money or anything. It's like their own choice. You can have healthy activities, you can go out in nature, you can take a walk, you can
Well,
have a practice of gratitude, you can serve others, you can have acts of kindness. All these kinds of things, are things within your control.
right.
That can
And
make a big
I think
difference.
volunteering, like you said, is a huge thing.
Mhm.
Because I've taken my grandkids to do different little volunteer things. I mean, they're always so proud of themselves when they do it. I mean,
Well,
it's
yeah.
you feel great. Well, I feel great. I mean, it's just part of making you feel valued and that what you can contribute matters. I think that, they want to do that. And often people right now are so busy that, I mean, it's not that hard for parents to look into some volunteer opportunities in their community,
Mhm.
where maybe they go with them. But, I think that,
Absolutely.
yeah, I think that's really important. And it shows them the right direction to go to feel better for themselves, and like you said, for the stress that they're
Yeah.
experiencing.
And it can strengthen your family bonding, right? It can really strengthen your own family support just by, yeah, giving to others, volunteering together as a family. That's another way to build into that.
Absolutely.
Yeah.
And I think too, one of the things that happens, maybe with parents and caregivers and grandparents, is that they're like, I don't want to use the word afraid. They're intimidated by their teenager. They don't know how to approach the teenager. They don't,
Mhm.
you love them. You can show that physically and, with things that you do for them and all that kind of thing. But I think sometimes parents don't really, and particularly grandparents, how to may have those conversations and maybe a mentor too. How do you approach the teen when you know they're struggling? What's your advice on that?
Yeah, I think well, one, just, I mean, the biggest thing is check in with them. How are you doing? And we all have that instinct. You have that feeling as a parent, a sibling, a grandparent when something's just not right.
Right. Yeah.
And follow that instinct. I always tell that there's a reason. There's that. It's like an internal voice that's telling you something's off. It probably is.
Uh-huh.
And kids just really appreciate feeling seen, that you saw that there's something going on and you're just doing a check-in, right?
Uh-huh.
Um, and just, I'm noticing that you don't seem like yourself, and I just want to make sure you're okay, and I care about you. Just that statement. Even if they
Absolutely.
don't respond, and I always don't worry about how they respond. They heard you.
Uh-huh.
And they know that you care, and that's super meaningful. Even if they have a teenage angsty, kind of
Yeah.
dismissive way of responding to it. I find, though, when you do that, kids in general really appreciate that. And they may even come back to you later. It doesn't have to be right there in the moment. They may come back to you. So definitely the check-in and just saying that, "Are you okay? I see a difference, and I really care about you. I wanna make sure you're okay." You'd be surprised at how much they'll open up.
Well, you're planting a seed. That's what I always say. You're
Uh-huh,
planting the seed in their brains, and they might not be, like you said, ready to talk about anything right that minute.
uh-huh,
But, one of the things that I always say on my podcast is, you don't necessarily want to schedule, let's have a big talk at the dining room table. It's little discussions here and there, and, different times. You could be at McDonald's, whatever, and something might come up that you
mhm.
can interject and, hey, how do you feel about that? Something you're observing or whatever. But
Yeah,
the
and I would just add, there's a few things I would add to that. One, it's really helpful if you little things like when you're side by side, so maybe in the car driving, a lot of people say those are great conversations because you're not facing them. You're right. You're not
True.
face to face. So it's not as intimidating. It's kind of an easier thing to have that conversation side by side. So the car ride is always a great place to do a check-in, right? I think that's a great place to have that conversation. And the other thing that I always tell parents is just you need to listen. You need to not talk. You need to be a listener.
That's a tough one, I know.
Yeah, for sure. And so talk less, listen more. Um, I feel like, and I know this as a parent myself, you want to impart all your wisdom in that situation
I know.
onto the child. You feel like, okay, that's going to, if I tell them this thing, it's going to change. It's going to be like a big aha moment for them. And then it's going to totally change the course of their life. And I'm not saying you don't say certain things to your kids through your wisdom, but the lecture, it feels like a lecture to kids. As a counselor, I got a lot of that feedback from kids that they don't want to tell their parents something because their parents going to give them a whole lecture about how it was for them and how they should do it. So talk
Which is so
less,
typical.
listen more, and just listen to what they say. If they are sharing with you, pat yourself on the back that you have a good relationship enough that they feel comfortable sharing it. And they're testing you, so they're sharing this information, and how you handle that is really important. So if you just listen, we have an acronym, we call it ORS. So you do the O is for, asking open-ended questions. And again, imagine yourself in the car, they're next to you, so they're not looking right at you. You might ask an open-ended question. Like we just said, hey, I'm a little worried about you. You don't seem yourself. I just want to check in. I really care about you. How are you doing? And then the A in ORS is affirmation. So when the kid shares, your child is sharing with you, yeah, I'm a little overwhelmed with school right now, or maybe a breakup, or an activity or something that they're whatever it is, a friendship issue, and they share that with you. You want to affirm, like, oh wow, thanks for sharing that with me. Because I'm really glad that you shared that with me. I didn't know that. And you're being reflective and listening. So just listen, be quiet. Don't say anything more than that, and see what else that they share. And then you kind of reflect back and you just listen and kind of summarize what they've said. And you don't have to do so what you're saying is, or what I heard you say, or those are starters. But usually I just, try to summarize what they've said, so I make sure I heard it right.
Right. Right.
And they'll correct you if you have it wrong, which is great. So then you
They
get the
will.
right information.
Yeah,
And
exactly.
then just end with, is there anything I can do to help?
Right. Well,
Just
I think
end with that.
right. Yeah.
And
I
let them say no, yes, and then just and really respect what they're saying when after you've asked what you can help. Because what I do find is some parents then will still they feel compelled to get involved and try to fix it. They'll call the school, they'll call another parent, they'll insert themselves. If your child tells you, I just wanted to talk to you about it, I think I got it, then say that's great, and if that changes, I'm always here for you.
Yeah, I think you're right for sure on that one. Well, on everything you've said, but I'm not exactly a helicopter or snowplow parent or whatever. But sometimes, we think the kid is just perfect. Everything's going great. Their grades are good. They have friends and whatever. And then you minimize in some ways the things they're going through. You mentioned breakup, so you've had maybe somebody in high school. It's a sophomore. I mean, I'm just going with an age group.
Mhm.
And they've just gone through a breakup that they've been, that has been very serious to them. And as a parent, for the most part, that life will go on, that, they will find someone else that
Mhm.
was maybe the right fit. And you want to say that to them, that this is not a big deal. Life will go on. But that's probably the wrong thing to say.
Oh, yeah. Yeah.
Yeah.
You
Yeah.
wanna just listen to how they're feeling.
Mhm.
Just talking about it is helpful for them.
Mhm.
Um, and so, and then it's, how can I help? And then you're gonna monitor that as a parent, right? So you've listened, you reflected, come back. If then you're checking in. If they're still not doing okay, though, you're checking in with them. Because we go back to what I said at the beginning. Mental health is how do you handle stress in a
Right.
healthy way? If they're not handling, that's a stress. And if they're not handling it in a healthy way, then what kinds of things you may need to intercede if you see that maybe their grades change or their sleep changes, or, these are all your warning signs, right? Behavior changes. And over time, you do need to get involved and get them helped. And we may have to get them some mental health support to deal with that, which is a protective factor, right?
Right.
So those
So
are all things where you as a parent are judging that, but you're
Mm.
not trying to do too much too fast, right?
Right.
Yeah.
Yeah. So would you think that that I mean some of the things that you said, are obvious. The first one everything says about no matter what we're talking about is, their life has changed, either their grades have
Mhm.
fallen, different groups of friends, that's a lot of with the
Yep.
addiction part of it, I know as well. But are there any specific things that parents should kind of really be sort of wondering about outside of that list? I mean, like, I don't know what I'm trying to ask you, but
Well, I think I know what you're trying to get at, and I'm just going to say this as what we always say in education is, behavior tells a story. And
okay.
so be a detective and
Mhm.
figure out kind of what you notice and follow those instincts. Parents, you have instincts. I mean, most parents I talk to, and when we've had different situations, they've had that feeling or something was off, and their kid was, something was changing. And follow that sign, follow those instincts and be a detective when you see behavior. There could be all kinds of different behaviors. The basics, I think a lot of people know when you look at sleep changes, eating changes, changes in friendships, all those kinds of changes in their grades. Those kinds of things are red flags that something's not going right, and you're going to do your check-in and you know help get resources and things like that. Get help. You don't have to do it alone,
Right.
especially if they're in school. There's all kinds of teams of educators, school psychologists, counselors, that can really that you can go to that can help you. Um, so just because there isn't every kid's different. We could go through lots of different scenarios, of
Mhm.
what changed,
Sure.
but I think in general there was some kind of change for that child that was
Mhm.
just off, right? Something that they normally would do, they didn't do, or and in the smallest ways or biggest ways. I know with my own children, if just checking in often clarifies, hey, I'm really stressed right now in school. In classes right now, it's really a hard time. Okay, is there anything I can do? No. Sometimes it's don't talk to me about it because I don't want to think about it anymore. It's
Yeah.
not talk about it. It's like, oh, okay, sure.
Yeah.
Thanks for letting me know that. And other times it's like, well, can you help me study or can you help me do this thing? Right. So it just goes back to that. Be a really good listener. And if you are a good listener, they're more apt to come to you. If you're
Sure.
always lecturing,
Yeah.
that's where you're going to
Or
miss that
accusatory.
opportunity.
If you're accusatory, that
Right.
that doesn't work either. But
Right.
one of the things you mentioned in the beginning, I'm not sure putting words in your mouth, but about the kids are a lot of them are overscheduled right now. They run from one thing to the next they don't even have any time for like, just
Mhm.
to stress a little bit. And right now, out where I live here, they're having state finals for football, and that's tonight. And I'm just I know a lot of the kids are excited, of course, excited about that. But some of these things are so scheduled. They get up at I know for football at like 5 in the morning and they work out and then they have practice and they do this and they do that. And that's actually all year round, I think. So I just wonder about the kids, particularly the boys, that hold all that in, that stress in, and don't share it with anybody that they are feeling that stressed. Do you deal with that or have you run into that with
Yeah,
young men?
I mean,
Mhm.
kids, yeah, I think, you know, I mean, there's all kinds of things on boys and men and expressing emotion and what society
Mhm.
teaches them, and
Right.
that's like a whole separate podcast
It
episode.
is, absolutely, yeah.
Yeah, but
Yeah.
I have 2 boys. What I find is, again, if I ask them, and I've always saw this with boys in general, even as a counselor, if I'm asking if I'm doing an activity or I'm in the car and it's more of a situation like that, it's easier to have a conversation that's back and forth and flowing. It's just easier with boys, I have found, than with girls, more like just talking like we are. It's just
Yeah.
women do a better job of maybe that
Communicating, yeah.
communicating, socializing, utilizing their friends, talking and sharing their feelings. And in society, it's okay to do that for women,
Mhm.
for sure. And so I think if you're in activity, if you're in the car ride, you can still get that. Um, it's just maybe not what I would not recommend is like, hey, we're going to have a big serious conversation. Let's
Right.
sit down and do that. I think with boys in general, I'm generalizing this,
Mhm.
because I have one child who talks all the time and one who doesn't. So it's not, I'm just saying this is a general kind of
Yeah.
statement. If you set it up for this big conversation, you're probably not going to get much. You're going to get a lot of fine, no
Mhm.
shoulder shrugging, I'm
Right.
okay, and not really getting into it versus you go for dinner, you're in the car, you might be playing a video game with them or something like that, an activity based. I feel like that tends to be a little bit different for boys. But and I want to say too about the scheduling, my my experience has been not to have these not to have kind of rules for every kid. So for kids, like for football, that's part of their physical health, that's part of their
Mhm.
healthy
Yeah.
activity. For the kids that love it, they might do better during
Mhm.
football season,
Mhm.
for them, even though it's a very packed schedule, it could be better for them. And there's some other kids who maybe they're playing football, but they don't love it like that. And so that can be a very stressful schedule for them.
Sure. Sure.
Same with academics. You have kids that might be gifted academically where taking a lot of AP or honors courses is really good for them. They
Mhm.
love that, right? And when they don't have it, they don't feel as good. Where you have other kids who are trying to keep up and do that, and that's extremely stressful for them.
Mhm.
So it's really knowing your own kid. There's no set rules, but in general, all of us need downtime. So scheduling
Yes.
your life out is not good. So when I talk to parents of younger kids, one of the things we always talk about is make sure they have a lot of free play. We love a structured activity or a structured craft or whatever, but they really need time to just play and not have adult intervention. That's how yes, someone might say something unkind, and that's how your child builds resilience. That's one of our issues. Is kids are not as resilient. They don't have built those skills. There's a lot of kids that are, but there's a lot of kids whose parents, you're too scheduled. There's too much adult intervention, and so you don't build up that muscle of resilience of how to deal with things. So yeah, even in
Just
junior high and
outside
high school,
activities. Yeah,
yes,
you
in
know, just yeah.
college, all of us, if we just worked, if we got up, as an adult, if you've had a really long day of work and then you might have things and you've got to cook or do whatever at home, and then maybe the kids have different events, it really, after a couple of days of that, you're really worn out. And when
Yeah.
you look at kids at their schedules, a lot of them have every day like that.
Mhm.
And so no wonder we have higher rates of anxiety and depression. If that's your
Absolutely.
life day in and day out, that's really hard. That's some serious burnout.
It really is, and back to the data that we were talking about or whatever, I earlier, I'm shocked at how many young people feel that kind of stress, on
Mhm.
like some sort of a poll that they take or survey. I would never have thought that, kids would feel that way, and I think that's a huge eye opener. So, when you're building programming for schools, families, workplaces, what do you think is the most impactful strategies that communities can implement to support mental wellness? And I know sources of strength. I love that, and you can talk
Yeah.
about that, but
Yeah.
yeah.
Yeah, all those kinds of, I mean, I love prevention, which is
Mhm.
a lot of times the focus is on the intervention.
Right.
So having, therapy and medications and all those kinds of things, which are great. We just are more on the upstream approach. So I think making sure there are prevention types of things built in, so that we can, which is really around education, becoming self-aware and educating. And then the thing that I always say, if you take care of yourself, just you work on your own mental health, it makes a massive impact with everybody that encounters you, whether
That's
it's at work or at home. That will make the biggest impact, for anyone. If we just all really focused on ourselves and working on our own mental health,
Mhm.
you're going to make a big impact. Kids mirror, they watch what you do.
Oh, yeah.
So they will mirror what you do. If you're using your phone all the time, um,
They will.
they have permission now to use their phone all the time, right? Because you're probably on it at meals or all the time looking at it every time there's some kind of downtime instead of maybe talking with your child. So, that gives them permission to do that. If you're not paying attention to what's your, healthy eating or physical activity, or how are you with your family, or all those things, they're watching all of that.
They
Do you
are.
have spirituality practice? Are you doing community service or some kind of acts of kindness? So we think about those protective factors. If you build those into your life, it's
Mhm.
going to have a ripple effect, and really, kids are going to see that and model that,
Right.
and all of that. So I think that's probably the most important, is to work on yourself. But then there's education. So one
Mhm.
of the things at 1 in 5 that we do is twice a month we have what we call QPR training.
Mhm.
It's a virtual training. It's free. So if you go to 1in5.org, and go to the events tab, you'll see QPR, and you can register for that. And it is it's like CPR for mental health. So QPR stands for question, persuade, refer. They'll go through all the signs and symptoms, warning signs for suicide, and so you have this nice community that goes through all of that information. And I think really that's a big part of, prevention work. It's just education. So
Yeah.
there's a free way. If you're a parent and you're worried about suicide with your child, I would highly recommend you do QPR, because then you will be able to see those warning signs. They'll go into that more in depth and have opportunities for you to ask questions. And so I think that's a great tool that's free, that you can do from your home. You don't have to go anywhere
Right.
in the
I
evening.
agree. I think everybody, parents, grandparents, caregivers,
Hmm.
foster parents, all should take that. I've taken it several times, and I always learn something the second time around
Yep.
that I maybe I missed the first time.
Yep.
But it just empowers you to
Correct.
feel that you can handle something should you suspect something's going on or whatever, and how to respond correctly without escalating the situation. I think it's wonderful, and I think everyone that has their hands involved with kids, be it school, be it, at the parenting end, be it, uh, well, I think we did it for like the firemen and the first
Hmm.
responders, and, it should be youth group leaders, everybody that has anything to do with teens needs to take that. And I think if we as a community are all educated like that, it could make a huge difference
No, for sure.
in saving some children that,
For sure.
like I just mentioned earlier, heavens, I don't understand. And that's what usually happens after a trauma, is that everybody just scratches their head and says, well, I didn't see it. I don't understand. That maybe with the QPR training,
Hmm.
they would have
Hmm.
suspected
Yeah, for
something
sure.
earlier.
For sure. And one thing I want to mention when you're talking with your kids, for, parents and grandparents or
Mhm.
trusted adults, whoever's checking in with kids, just to say, if you want to, you can ask them about suicide. Have you thought about suicide? It does not put the idea in their head. I think that's one of the most common myths.
It
I
is,
want to
yeah.
talk around it. I don't want to actually say it. And that does not put the idea in their head. That's not going to impact them negatively. In fact, all the research says when you do ask, they'll be honest. Kids will be honest, and and tell you about that. One other program that 1 in 5 does in schools is called the Signs of Suicide. At Marymount, we did that. We've done that for, I think we're going on now 13 years. And it's educating kids on signs and symptoms and warning signs and how to help each other and how
Mhm.
to go get a trusted adult when you have concerns, even if it makes your friend mad.
Yeah.
And talks a lot about that. And then they do a screener. And kids answer different questions and we score those and then do individual assessments. But here, people are always like, oh, I bet nobody really fills that out. They do.
Mhm.
They fill it out. A lot of them will ask to be seen by somebody. A
Mhm.
lot of them will ask to, they want to talk about their friends.
Mhm.
And they will be very honest in the questions, ask, have they ever thought about suicide in the past year? And, kids are very honest about that. And we often, are saving lives through that program, and getting kids help and helping parents with their kids that didn't even know that there was an
Right.
issue. Kids are good at,
So
masking that. Hmm.
So finally, now for listeners who want to learn more or get involved, you mentioned the QPR is on the 1in5.org, and but there's a lot of resources on there, as I recall, that
There's a
they
lot of resources.
yeah.
Yeah, and we have a, reach out app that you can download. One of the things I think is really powerful, when I was a partner with 1 in 5 as a school person was just their videos do great storytelling. There's a lot of videos, and I think it just makes you feel like, okay, I'm not the only one.
Hmm.
So watching some of those videos from from youth that have had, mental illness, dealing with mental illness, parents and caregivers that are as a parent or caregiver, how that feels. And information from, we have things on there from Cincinnati Children's Hospital. We partner with them a great deal. And so they have so many great resources on there, different videos. You can follow our Instagram, our LinkedIn. A lot of those videos and different resources go out through there. But
You have a
that
good newsletter too.
we have a new monthly newsletter you can sign up for that you can get all kinds of great things. And there's ways to volunteer, there's ways to, but just a lot of resource information is on that website. So I think it's a great place to go just to get some information and hopefully you don't feel alone and there's some things there. 988 is a crisis line for youth. I think through age 22. And there is this year they deployed the mobile crisis unit with that. So you call 988. About 75% of the calls are going to be able to help you de-escalate and help you with that. And about 25% of the calls, they're either going to send you on to a hospital or send mobile crisis out to help you right there where you're at. So that is another
Yeah,
great resource. Do
it
not
is.
hesitate to, as a parent, if you have questions or you're really concerned about something, call that 988 number. They will help you.
Yes, and I think if nothing else, there's somebody for you to talk to.
Yeah.
There's that, and sometimes that's really just all you need
Hmm.
is somebody to talk to. So I know they've put that 988 all over the schools,
Hmm.
and trying to promote that. And I just think that's wonderful. There's
Yeah.
so many wonderful people trying to do so many wonderful things for our teens, and we need to just be like you
Absolutely.
said, grateful, really grateful that people care and that they want to do that. So I guess we've come up now on a kind of a hard stop, and but I can't thank you enough, Tricia, for coming
Oh,
on and
yeah.
sharing your wisdom, and your experience, with our listeners. And hopefully, this will begin to stop the stigma around, well, mental illness, but also just what's positive, and what can be helped with our kids for their mental health journey. That they, because these are things when they learn them, they'll carry through into adulthood.
Oh, yeah.
And so this is so important, and I just can't thank you enough for being here and talking to our listeners. So with that, I'm going to just finish what we're doing here and thank you again. So if you're
Thank
walking
you, Denise.
away, oh, you're so welcome. Thank you. If you're walking away with one thing, let it be this: our teens don't need perfection; they need presence. They need adults who ask questions, who listen without judgment, and who recognize when something isn't quite right. 1 in 5's work shows that when communities come together, parents, schools, and organizations, we can change the outcomes and give young people the support that they deserve. In this episode, if this episode was helpful to you in any way, please share it with another parent, educator, or friend. These conversations do make a real difference. And be sure to check out One in Five's resources, as we discussed, programs, the tools for families and schools who want to take that next step. You can see these podcasts on Apple Podcasts, YouTube, social media, including Facebook, Instagram, X, and LinkedIn. You can also access them on our website, which is www.stepupanderson.org, and listen on Spotify. But please share and, most importantly, subscribe and follow us so that we can reach more parents. A special thank you for being part of the Step Up to Save Our Children community. Together, we can raise awareness, spark some change, and support the next generation. Thank you so much to my listeners and again to Tricia. Until next time, thank you.